Hello. Today's topic of discussion for the webinar is improving student-teacher morale and health checkups for the students. Why this topic is selected out of all the interesting topics of the cardiology? Mainly because we are seeing that many students are going into the depression and not able to perform their activities very well, even though they are getting the DM seats and the DNB seats to do the higher educations, but they are not able to fulfill their criteria. And even after the education, when they are settled in the higher posts, they are not able to do the good performance. So that's why we thought it is interesting and it is important to convey the message to the students and the people who recently finished their education and settling in their life. So that's the reason why we are taking this topic. I'm Dr. Jyotsna, working as a professor of cardiology in the NIMS Institute of Medical Sciences. As we already know, simple education is not sufficient. With a proper guidance and support, the success will be there with us. What is the importance of the student morale? This is mainly depends upon the subject satisfaction. That if suppose one person is interested in the cardiology and he gets according to the rank, the nephrology, and he takes and he suffers, is not a good. And opposite is also is true. So he has to be very much interested in the subject what he selected. Of course, this is true for every education system, not only to the medical. And outlook and feeling of well-being of the student within his or workplace. The workplace, the environment is the most important one where they are doing the studies. If they are not adjusted to that work atmosphere, then it becomes a very stressful from the day one onwards. But many of them will adapt within a short duration to the work requirement of the place. The student-teacher morale from the New York University study is mainly depends on the characters of the education, interaction of the peers, interaction with the teacher, and perception of the education. The characteristics of education, as I already mentioned, that suppose this is a cardiology, I'm going to take the cardiology as a frequent example. So you have to be mentally prepared as a student to know all the modalities of the non-invasive investigations like the echocardiography, treadmill test, and the Holter reading, and simultaneously the patient's support to give the morale to the patient because they are having a sudden onset of an acute MI, so the patients has a maximum anxiety, and simultaneously they should able to do the invasive procedures like the coronary angiograms, angioplasties, and recently now involvement of the TAVR program also. So they should know that how much they have to acquire each skill one by one. So they have to have a scheduled program to know about their education status. Then interaction with the peers is very, very important. The colleagues, usually most of the people will think that communication with the colleagues will cause the leakage of their ideas to the other people, so that other people use that ideas properly, and these people are not benefited by that. But that is a wrong impression everyone is having. It's better to communicate with other people to know that those people ideas are also, and once you start expressing your views about a project or about a research, whatever you wanted to do, the flaws and the negativities will be known by yourself when you are expressing it, and some people will get a good information from the colleagues. And not only about the research, even for the routine activities of your problems during the wards, the working hours, the stress, all those things, if you interact with your colleague, he may or she may able to give a better solution. How she is able to adapt, that may be helpful to a particular person. And interaction with the teachers, this is the most important. Many people are not communicating with the teachers. They separate the teachers and the students as a separate two groups of the people, which is not true. Actually, teachers are not there to only trouble the students. That is an impression of most of the students we are experiencing as the teachers. But the teachers are there to help the students also. There are the group of the people of the teachers who are not as so cooperative and not communicative. But as such, one of the responsibility of the teacher is to communicate with the student, not only for the education, even for his other advisors, like how he can come out of the stress and how he can plan for the next 1 or 2 years of his education. And sometimes they may be helpful even in his or her personal life also, because many teachers are already experienced like their mothers and their fathers. So they can take that advantage and communicate with the teachers. And the perception of their own education, that is most important. Once they come to the particular subject with interest on that, but after coming they realize that it is more stressful and they may not able to adapt to that, and they wanted to leave it. But if really their perception about the education is the proper, such a simple initial hazards should not be obstruct their ideas. This can be come by the talking with another students or with the teachers. And another important thing is the student-teacher responsibilities. They should know about it. Student and teacher should remember that although they are under prostration, they are still associated with the teaching institution and therefore act and work accordingly. So we can't say that student can't say that I will work till now. I worked in a government institution, so the 9 to 2 hours only. Now from an institution in a teaching institutions, it is working hours are more prolonged. So I'm not used, so I can't work. So you have to, before coming here itself, you know what is the working habits of that institution, and not only that. There may be nowadays it's become a compulsory to have their paper production and a presentation in the conferences. All those things they have to think before and do it. Even for teachers also is like that. If they're already coming from the same institutions, they after their graduation, they're becoming the teachers, then it doesn't become a problem for them because they already know what is the usual tendency of the teaching program in an institution. But it may become a problem from the one institution, people will come to another institution and do it, but they have to adapt. Teachers also have to adapt to the local environment of that institution. Students generally seek a teacher who can interact with and who has a knowledgeable and has the skills to direct a program successfully and respect in the institution. So the major thing is the teacher has to maintain their capacity of not only expressing the knowledge, the communicating skills also. Otherwise, the teacher becomes very rigid and he says, no, you have to do this, you have to do like this, and leave the things, and he doesn't talk with the students, then those students doesn't approach the teacher. Then the teacher skills are wasted. So also the student also perceive, even though teacher says something sometimes in a very strongly or hardly, they have to think that is because of the essentiality of the important point than getting angry on the teacher who is saying like that. And the key to the health morale of any program is communication. If you, a student or a teacher, is against of a student or against of a teacher, then communicating directly with that particular person is much better than discussing with someone else. He talked like this or she did like this. In this way is not good. Direct communication. Directly talk with the student. Why he is done like this? That gives a better information. So also student, if he thinks that he has done properly, but still a teacher points it out, then better to go and ask them directly. Madam, how can I improve this thing? Why, where is my failure to do it? So if you communicate, that is a much better way of having a good relationship. The student and teacher should also keep updating their knowledge and skills. The student thinks that, okay, for my exam, I have to read in the anatomy, in the cardiac anatomy, this much is sufficient. And if anything is asked beyond the cardiac anatomy, what is already in the curriculum, if it asks, then he says that no, it is not in the curriculum. If he feels in this way, nowadays it is expanding field, like a tower. You have to go in depth into that of aortic valve, morphology, annulus and everything. So this may be an expanding indications for their curriculum. So they need not to stick on to this curriculum, what is laid down long back. It has to be changed according to the requirements of the newer education. So also teacher can't say that the bedside I used to do like this, so it has to be like that only, nothing else more than that. Not in that way. The teacher also has to update themselves continuously by reading the journals and attending the conferences and doing the live cases, discussion with other colleagues, so that both the people are at the peak of their knowledge, then the communication becomes very easy. Why the teacher morale is important is the lack of the teacher morale can influence the number of the ways. If it decreases the productivity, they can't guide their students much properly to have many research papers. Daily decisions, even so one person is an absent to substitute another person. Again, if they doesn't have any communication, this becomes a big hazard in the management. And relationship with the co-workers and management. If you are not very free with your co-workers, and every time you talk harshly with them, then your relations goes off. So when you want to do a collective program like a conferences, you can't have the support from your colleagues. And attendance and punctuality. So once they go into depression, many people apply the leaves. So absenteeism increases. Absenteeism increases not only causes the health hazards, but decreases the intelligence also. Everyone should motivate themselves toward the improvement. Most of the time, we think that if someone says, we'll try to follow that much and leave it. But we came to up to a certain level. We are not in the primary school or secondary school where some good things has to be told by someone else. We already know what is good and what is bad. And we should have the motivation to the constant improvement. And accountability. Accountability is very, very important. Suppose a job is given to you, like you supposed to write a paper, then that job has to be taken with all the responsibilities. Not that I didn't got this information about the literature or the results I am not able to. And there are some students, they will come and say that already my time duration is over, madam. I could not complete my project. Can I manipulate and write it off is available? Teacher also should have followed an ethics. Once the teacher agrees that, okay, because the exams are coming, you slightly modify it and write it, is not a good way. You have to tell him that this is wrong, and if really his career is going to be then affected by not able to write the exam because he has not finished his work, then do the modifications and say the same thing. Tell it to the ethical committee to inform that only in the project you are able to do the half the project. You are not able to do the full project. Let the information go to the ethical committee and let them write this in a half project as their this thing. That is a better way than saying that, okay, you finish something and show something to the examiner to go for the examination. Those advices never should come from a teacher. And know the purpose of the work or doing and very clear vision. When a teacher tells that he is supposed to do this job, he has to explain very well. Suppose the same person comes to the cath lab and the first day he comes, he has to be then acquainted with all the gadgetries available, how the pressure recording has to be done. So that is the teacher's job in the first few days to give them the guidance. Then if he doesn't follow, then he can say that yes, you have to go and read, you have to do the practice, or you have to ask other people. And the work-life balance is very important. Initially for a student, it may be a difficulty very much because it is an entirely different field has come and then he has to adapt to that. But do not ever give yourself any excuses about anything you do not do. Always you try. Suppose that one job is given to you and you are not able to perform it, you motivate yourself. How can you do it? That is a better way than giving an excuses that why you are not able to do it. Many people will say that I did duty. I have the personal problems, so I am not able to. Good. All the people will suffer the same thing. In their family it happens. But they have to try to come over how they can do it. The self-motivation is much better than taking an advices from someone else. I doesn't mean to say that you don't take an advices, but this is much better than that. Scheduled program, try to follow the scheduled program. Academic schedule is there. Limited hours of the work. And even teachers should give some flexibility to the scheduled program also. Student relationship is very important. Always carry a positive energy and share positivity among your colleagues. Be transparent work you do. Try involving your colleagues in to be open for sessions. Don't try to do the things secretively. That doesn't fetch you in any way. Always get feedback from the colleagues, management, and also yourself. Whenever you do your work, you rethink once again whether you are going in the correct path or not. Keep learning new things always. Everything is a learning and nothing ever gets waste. Many people feel that cardiology people learning a radiology or some other subject may not be useful, but in your practice, it helps you. If you know one technology, you can extrapolate that to your own way to your department. Also educate the people around you. That is the most important thing. 3 ways to improving the student morale is daily practices. Whatever they decide, they have to try to do every day. And the philosophy, of course, works at every time. Outward bonds, which is nowadays is done much more frequently by the institutions, either conducting education camp or otherwise recreational camps. Improving the student morale every day can be done by students who enjoy the class and do not hurry to leave. That is the responsibility of a teacher to create an atmosphere like that. Collaborate well with each other. Respect and think fondly of their teachers. Don't think about put lower impressions about the teachers. So once one person talks about it, that decreases the respect on the teachers. Go above and beyond what is required. Participate in the class and outside. These two are the very important to have a improvements in the students' thinking. Not only the students, even teachers should show the enthusiasm. If the student comes with an idea, they should be able to guide them properly. Self-discipline. Before telling to the students, they have to implement that and show it. Willingness to share. Whatever the ideas, they have it, accept them and think whether it is a correct pathway to think about it or not. And teaching should be felt as an enjoyment, not like a burden. Some of the teachers' responsibilities are to appreciate the students. To do that, it is need not to be always a money involvement. Suppose in a group of the people, if you say that this person is presented very well, that gives a much better satisfaction. And exemplifying the mutual respect. If the student wishes you in the good morning, if you respond, teacher also responds immediately, that gives a morale to him. Relate the lessons to the real life, that giving in a proper examples is much better than telling the bookish description of a disease or anything may not able to remember. If the teacher tells a few of the cases which they have seen it, then the students can understand much better way. Allow a free exchange ideas. Practice the fairness. Display a willingness to allow the student to take the ownership in the classroom matters. Choosing an attitude is the most important. Choosing your attitude allows you to take a control over your bad moods and change it quickly. It's not that you are the bad person from the beginning. That situation may make the way you talk badly. So you can change your mood very well. One of the ways to do it is simple smiling. Some people smile to themselves. Other people, when they look at them, they may think that they're already become mad. But that also gives the relief. Similarly, taking the deep breaths, which is very well practiced by the many people. That is one of the ways that yoga also practices, which can be practiced either by the teacher and the students during the stressful situation. We should have the bias to S. And always we have to think positively. Don't think that it can't be done, this job can't be done. If it is already suggested one job by the teacher, it is possible to be done by the student. So even though the student thinks it is difficult to do it, they should evaluate the ways to do it. So the positive attitude always makes a difference. Now I'll give a few of the examples of the medical students who are affected during their education period. The first example is a student of MBBS from the government hospital, and she got a seat in the JIPMER, very advanced academic institution. From the childhood, she's an outstanding student, but after joining to the JIPMER, her academic programs, academic achievements are drastically decreased. Everyone was wondering what happened to that. But the proper counseling was done, why she is not able to do it, and how she has to adjust her hours of working, and how she can communicate with the patients, how fast she can do the job, the same amount of the job, much better way. And she took about 6 months and she's improved significantly. That is known as the adjustment disorder. So in this disorder, simple counseling is sufficient, and many of us, whether the change of the profession or a change of the place or a change of the mode of the job what we do, we face this strain during that period. But fast adapters can adjust much faster, and they doesn't feel any more anxiety, and they adjust to the situations very fastly, and they show their performance very well. Few people may take a little bit a longer time. So the adjustment disorders are almost invariable in the many people's life, but many of them can adjust very well. So it doesn't require any medical treatment. Another example is depression. That is, third daughter, the previous two daughters are then very well educated, well settled. Always the parents and sisters used to compare this third sister with the other two siblings, saying that they are so excellent, so good, and she is not able to perform the same thing. After the few days, she is not able to, the third daughter is not able to get a sleep and feels very weak, not able to do even routine activities, and up to the extent that she can't even enjoy the party also. The parents are worried a little bit at this stage, and they started investigating whether she has any illness, because they thought that some other chronic illness like an PU of an uncertain origin or the tuberculosis or something which is responsible for her weakness and not able to enjoy the things, everything. But finally they did not find anything. The major problem in this child was the depression. The cardinal features of the depression are lack of sleep, lack of energy, and the lack of pleasure. This child from the childhood was compared with his higher competitors of her own. So every person can't be perfect in the way the parents want it. That has to be realized. If the child is then good in the drawing, that is the duty of the parent to recognize that and put it in that line, than insisting on the what subject she doesn't like and insisting on doing the same thing. Just because the elder siblings are the good, the third sibling has to go in the same pathway is not correct. So in this example, probably the child requires a medical treatment also, because she is depressed for a long time, almost from the childhood. So at this time, simple counseling may not be helpful. Acute depressions are usually the very counseling they will become okay, but chronic depressions may require a medical treatment. Another third example which I am going to talk is extreme end of the depression. That is, a 25-year-old female joined in a post-graduation, and she had an excellent career background and being the first rank in the childhood and excellent performance in all the jobs what till now she has done, and always the seniors, everyone used to appreciate, and she committed a suicide. So everyone is wondered what happened to her, such a nice free-flowing life, why she has to end her life. So no one able to think about the reasons for her death. So actually these situations, everyone is thinking what happened on the day of the death, and they started inquiring about the day of the death. But actually the single day or single incident doesn't lead to such a drastic decision of the persons to commit a suicide. Usually the pre-moribund personalities, if they already have the personality disorders, then a provocative features like one of the two incidents may lead them to do the commitment of the suicide. In the same way, the family support. If she has a very good family support, she would have been talked her problem with other people. This is not happened in this girl. And the conditions, where the working conditions or the house conditions will make the difference. Medical illness, sometimes hypothyroidism. So severe hypothyroidism can have the severe depression, which may not be detected. So all these things has to be evaluated. In this child, all these things are seen, and finally what we found was she attempted multiple times before this successful suicide. I'm using the word successful because she already committed. So that is mainly because she is being a doctor. She know how to take an IV insulin and tried for that, which is already she has underlying personality disorders. The personality disorders can be of a type A, type B, or type C, depending on whether suspicious, emotional, impulsive, or anxious. If you are intelligent enough, even though you have this personality disorder, you should detect by yourself that yes, I have this disorder, so I have to come over that. Then they have to take a counseling. Sometimes they require even a medical treatment also. Suppose the suspicious person knows that even though one evidence is against or multiple evidences are against of an idea what he or she is having, she is not ready to accept it. So the personality disorder person knows that yes, I am having a suspicious, even though it is wrong, but not able to convince it. So she has to counsel herself and take the medical advice also how to control the personality disorders. And so this, in addition to the counseling, requires a medical therapy also. How to maintain the good quality of the life, that is the most important. All these times we are talking about the problems, but it is our duty also to adapt to the good environments. And teaching of the ethics from the childhood. If everyone teaches the only ethics from the childhood, then it becomes a routine. They need not to learn subsequently. And ethics has to be practiced by teachers. Just by teaching is not sufficient. If they practice, immediately will be followed by the students very easily. Communication skills to the other students and to the teachers is a key point. And we should keep our good health. So for that we require then health checkups and then good exercises. For the students, the lipid profile, I wanted to tell a little bit in depth when the lipid profile is required to be tested. So the many people doesn't give them much importance for the testing of the lipids, but according to the Pediatric Association, at least by the 9th to 11th year, in between these this age group, they have to test once. If not, at least before the 20. If they have the risk factors, then they are likely to be present. They have to test their lipid much more frequently. Like if they have the overweight, or they take then frequently fatty diet, or they don't exercise, or the family members are having the hypertension, the diabetes much more frequently, or the child themselves, they smoke. All these things, if the more than one risk factor is there, then they have to definitely test the lipids. So also the diabetes. There are the few risk factors who requires the blood sugar to be tested. Like the race, Indian race is nowadays increased very frequently. And the insulin resistant conditions like hypertension, already having a lipid abnormalities, and in the females especially polycystic ovary syndrome. So, and reduced birth weight. When they have a low birth weight at the time of the delivery itself, or having a mother with diabetes, or already has a glucose intolerance, these people better to test their sugars in between. If the more than one risk factors of the already said factors are there, then it is all the more reason they have to test their sugars. So also in the hypertension, if there are the overweight people are there, and the family history of the hypertension is there, and especially in the boys, and the mothers who had smoked during the pregnancy, these risk factors are there. They are also better to check their blood pressure. So in general, lipid profiles and blood sugar and blood pressure at least once before the 20th year, a checking is advisable. So if they have any abnormality, it can be rectified immediately. And exercise is very, very important. Almost from the 18 to 64 years, according to the WHO, the physical activities includes the leisure time physical activity. This is mainly to improve the cardiorespiratory, muscular fitness, bone health, and reduces the risk for the non-communicable diseases. In addition, it decreases the depression also, which is a major problem of the present society. The simple walking, dancing, gardening, hiking, swimming, transportation, that is either walking or cycling, or at the work using the different places or the games or sports, all these things can be done to have the good fitness. So what is the recommendation is between 18 to 64 years is at least 150 minutes of the moderate intensity aerobic physical activity throughout the week, or do at least 75 minutes of the vigorous intense aerobic physical activity throughout the week, or an equivalent combination of the moderate and vigorous intense activity. Aerobic activity should be performed at bouts of at least 10 minutes duration. And in addition, we wanted a better health, then instead of 150 minutes, we had to do an exercise of 300 minutes. So muscle strengthening activity should also be done involving a major muscle group or 2 or more days a week. And today I am going to talk about the one condition that is known as the Takasubo cardiomyopathy, which is all of the medical fraternities already knows. This is just excess adrenergic discharge. So when there is unhappiness news is heard, or things happens, suddenly the heart contractions will become very weak, and patients will have then almost like an MI. ECG demonstrates the ST segment elevations, but coronary angiogram shows that there won't be any obstructions, but basal component of the heart contracts vigorously, whereas an apex and other component of an LV that bulges out. So this causes the severe LV dysfunction and going into the heart failure. So here having a sudden excitement, a sudden hearing the bad news is everything. So if you adapt before itself to stress management, may not happen all those things. And another thing is why we have to worry. Actually, in the words of the Swami Sukha Bodhananda, who is the follower of the Swami Vivekananda, he says that worrying is become a habit to the many people. Actually, whenever the worry comes, you think over and convert that worry component as a challenge to you. That is possibility. Suppose when work is given, you can't do it, then you think why you can't do it, why it is not possible to do it. If it is other people are able to do, why I am not? So take that as an opportunity. Then your self-confidence also improves. So the self-confidence means that feeling the good thing, taking the responsibility and the development of the skills. This is one of the excellent example what I found it is useful than worrying on the situation. So my take-home message to the students is a healthy relationship between the student and the student is very useful to decrease your stress levels, and the student and teacher also should have the healthy relationships to have the good guidance. And not only that, with the institution requires you in that format what they wanted, so you have to mold in such a format. And health of the students is very, very important. Like, don't neglect the testing of the sugars, blood pressure and the lipid abnormalities, and the strain management, stress management is very, very important. Always have an attitude to say yes. Don't think that it is no to anything. If it is existing or someone else is able to do, means you also able to do it. So improve the communication skills, take a self-care that will show the success to you. Thank you.